מד"א, שלום נועה. כן אדוני, איך אפשר לעזור? כן אדוני. In MDA we received the calls in less than 5 seconds. כן אדוני, אנחנו שולחים אליך אמבולנס.
אני אחד מ-4,500 כונני תגובה מיידית שמגיבים למאות אלפי קריאות בשנה.
בכל שנה עוברות ניידות מד"א ברחבי מדינת ישראל כ9 מיליון קילומטרים על מנת להגיע למטופלים ולהציל חיים.
בכל שנה אנו מפנים כ-750,000 מטופלים לבתי החולים.
אנחנו אחראים על חייהם של יותר מ9 מיליון ישראלים.
זמן תגובה של צוותי מגן דוד אדום הוא מהקצרים בעולם ועומד על 8 דקות בלבד.
In MDA, we have more than 168 dispatching stations covering all over Israel.
Our fleet has more than 1,200 ambulances, 650 first response medicycles, 2 Medivac helicopters and a Seabulance, all designed to get Israelis the life-saving care they need faster. We are Magen David Adom, Israel's national emergency medical service.
In the battle against the novel coronavirus, there's one organization in Israel which has been on the front lines since the very beginning, Magen David Adom. We'll now learn more about their work from Eilat Shinar, head of Magen David Adom's Blood Services, and Dr. Shafir Botner, the director of Magen David Adom's Paramedic School.
Welcome. We have with us today Dr. Botner from Magen David Adom, as well as Professor Eilat Shinar. We're going to be talking today about the work that Magen David Adom has done during the 7 months of the coronavirus crisis. I wanted to start with you, Dr. Botner, to get an idea about what has gone on. Now, in the first part of the first wave of COVID-19, Magen David Adom was very focused specifically on testing, but I know that that has changed somewhat in the second wave. Talk a little bit about what's happening now.
Well, as you mentioned, Magen David Adom in the first wave was responsible and made almost the majority of the swab tests for coronavirus in Israel. Right now, on what we are calling the second wave, Magen David Adom is also doing those swab tests together with the Home Front Command and together with the HMOs, the Kupot Cholim of Israel. But we also now have to treat patients with coronavirus that are stay at home or transfer patients from corona hotels to the hospitals or from the hospital to the corona hotels, etc. So that's a major part that we are doing now. And of course we are helping in all the things that the Ministry of Health need to make all kind of experiments for new testing of coronavirus or new treatment for coronavirus, as Professor Shinar we'll talk a bit later.
That's amazing. And I know there's about 1,200 people in hospital right now, but that means the rest of our sick patients, we have about 50,000 in the country, are actually in hospitals or being treated at home, which would then fall under your purview.
Right.
Amazing. Now, Professor Shinar, I do want to turn to you because your role is actually very unique in that you've been working for more than 30 years on collecting plasma for Magen David Adom, which has become actually essential in the coronavirus crisis. It seems that the work that you're doing is to create what's called a passive vaccine. Talk to me a little bit about what that means.
Sorry.
Sure. So can you explain what a passive vaccine is?
Yeah, sure. Whenever we are met with a virus or a bacteria, our immune system makes antibodies. We are the protein that swim in our plasma. These proteins can be collected from the plasma and given to patients as such, so they can fight the antigen, which are the viruses, and kill them. We've been doing it many years ago in Israel for other viruses. And of course, when the coronavirus pandemic started, we were immediately ready to do that for the people who recover from the disease. We call it convalescent corona a virus plasma, and we provide this plasma with antibodies in it to treat patients with severe or moderate COVID-19, which is a disease.
Amazing. Now, there are two types of plasma, from what I understand. There's one that is just infusing the plasma, I guess transfusing the plasma, and then there's another kind of medication that is being created. Can you explain to me the different kinds?
Right. The source is the same. It's the plasma of the convalescent people.
Okay.
Some of the plasma is given as such, and some of it is actually given to an Israeli company who concentrate the antibodies out of it. So they make little vials which contain the antibodies, just the antibodies concentrate. And this is just now on a clinical trial in Israel given to a patient in severe and moderate disease. And I would say that I think 11 out of the 12 responded very well to this treatment. So most of the patients, 900 patients in Israel, get already the plasma transfusion. Okay. And some of them, when the medication is ready, will be getting the medication as treatment.
Amazing. Now, you said 11 out of 12 have done well. And what does well mean? Because what I had heard was actually that within 72 hours, patients were seeing that they no longer had the virus and were going home.
Well, the idea is, and this is our own experience in Israel, on the first 50 patients, but now on more than that, hundreds, but based also on the Mayo Clinic test or research of 33,000 American patients, that you need to get the plasma very early in the first 72 hours, and you need to get the plasma with high level of antibodies. So if you catch it before the virus spreads, before it makes the damage in the body, this is the right time to do that.
Amazing. And then if you don't give it on time, essentially the virus might go away, but there'll still be repercussions from the virus.
No, it doesn't go away. It stays, and then it does all the terrible harm that it does to the lung, to the heart, to other systems in the body. Because then we are dealing with what we call the cytokine storm, which is a reaction of the body to the virus. The idea is to catch the virus and catch it with the antibodies before all these disasters happen. But I have to say that I know of very sick patient who got also a plasma transfusion and did well. We don't know if it's the plasma or other treatment that they got, but at least, again, we say the early possible and the high level possible of the antibodies in the plasma is the right treatment.
Amazing. So I want to turn back to you, Dr. Botner, for just a moment. During the first wave, I actually went and I visited the Magen David Adom headquarters, the call center there, and really watched as the people were there on the front lines. And they had incredible stories, not only related to COVID-19, but to treating patients on the sidelines of COVID-19, which of course medical emergencies do not go away just because we have coronavirus. I was hoping that you could share with us a couple of stories, from recent weeks, stories that really articulate the power of Magen David Adom during this time.
Well, as you know or may not know, Magen David Adom is also doing humanitarian activities. And we saw, I don't want to say a lot of cases, but we saw a number of cases of people that we got home, to their home to swab them, to make the corona test. And we see a very, perhaps, poor home or lonely older people. And the teams of Magen David Adom recognize these situations, call to their manager or to their responsible person, and we actually took care of those person. We brought some stuff they need. It may be food or blankets or medication that they cannot go outside to go to buy in the pharmacy, all kind of stuff like that. We have person that are suspected to be positive to coronavirus. For example, 2 weeks ago, a young mother that had a little baby, infant, and she was afraid to breastfeed him because of the coronavirus. And the team of Magen David Adom arrived over there, explained the meanings and the importance of breastfeeding, and well, one kind of humanitarian stories, as you said, except the emergency calls that we are still having. Those situations didn't get away because of the corona.
Right, amazing. Now, the hospitals just in the last couple of weeks have really raised a red flag. They said we are overcrowded with today over 1,200 patients in the hospitals, and the units are bursting at their seams. What do we need to do in Israel to make the situation more viable, other than, of course, less coronavirus?
Of course, the main goal is to reduce the load from the hospitals. So you can do it by two ways. To solve the corona problem if or when we will have the right treatment or the vaccine. And the second one is to give the people the ability not to go, or the option not to go to the hospital. So that's what Magen David Adom is trying to do right now. Person or people that are sick or moderate sick and do not necessarily have to go to the ER. Magen David Adom brings, the team of Magen David Adom brings the doctor and the medication and the medicine and all the exams that he needs into the home.
Amazing.
We're taking telemedicine machines, the telemedicine exams, and the patient can actually video chat with the doctor at the Magen David Adom Dispatch Center. The paramedic is at home, can make the blood test, the doctor can actually listen to his lung, listen to his heart, watch through the ear, through the throat, and actually check the patient without the need to go to the ER. So that's one of the options or the possibilities or the action that we are doing to reduce the loading in the hospitals.
It's an amazing thing, really shows why we're the startup nation and also really could save our health system, I suppose. Now, we only have a couple of minutes left, and I wanted to hear Magen David's message. First of all, I wanted to hear from you, Professor Shinar. Why are you glad, despite all the challenges that we're experiencing right now, that you do what you do?
I think that we are really facing a war, as we say, and we see everybody coming together to help. Blood donors that are scarce in the United States. We call them, they understand the need to come, and they come. We put into the regulation that one of the things you can do under the lockdown is to go and donate blood, and people do that, so it's amazing. The plasma donors. And the most important thing for me, I think, is the new project that we're having. We are building our new blood services center in Ramla, which will be totally protected from missiles and for any threat to Israel. It will have 3 underground floors and 3 ground floors. And this is, for me, the most important project, I think, that Magen David Adom has, and maybe the country itself, because it's the National Blood Services. So we are all looking forward. Hopefully, Bezrat Hashem, next year, we'll inaugurate a new place.
Wow, congratulations, that sounds amazing. And Dr. Botner, same question to you. What is the message?
Well, Professor Shinar said that we are in a war and we are dealing with unseen enemy. And for me, as one of Magen David Adom staff member, I would say that we are feeling now that Magen David Adom became the IDF of Israel. And I'm proud to be one of the soldiers and one of the staff of Magen David Adom, with a great motivation. The people of Magen David Adom had a lot of motivation. No one doesn't say anything except, I'll be there wherever and wherever you need me. And that, of course, makes me proud to be part of this family.
Amazing. Well, I'm very proud to have been a part of your family for just this short time. Thank you both so much, Dr. Botner and Professor Shinar, for joining us today.